Running a pediatric practice is demanding. You are managing well-child visits, vaccine schedules, and parents with urgent questions. The last thing your staff needs is to worry about whether a claim is sitting in a denial queue, costing you money. Look at the numbers from 2024. The initial claim denial rate across the healthcare industry rose to 11.81%. Data from the MGMA shows that up to 15% of medical claims are now denied or delayed. Nearly 2/3 of those denials are recoverable, but tracking down those errors burns staff time you simply do not have. Pediatrics carries its own specific layers of difficulty. Well-child visits, vaccine coding, behavioral assessments, and newborn care represent the highest risk categories for claim errors. This flowchart maps out the logic gate for newborn codes in the P00 to P96 range. If a coder applies one of these codes to a child older than 28 days, the system kicks back an automatic denial. The specificity requirements are absolute. Injury and external code codes demand 7 characters. A single missing digit results in an immediate rejection. Because of these strict rules, Experian Health reports that over 41% of providers now see at least 1 in every 10 claims denied. Your front office is already stretched thin managing patient flow. Layering these intricate pediatric coding requirements onto those daily clinical duties creates a steady, invisible leak in practice revenue. Attempting to solve this by constantly hiring new in-house staff gets expensive quickly. Replacing just one front office or billing employee costs between $9,000 and $12,000 in recruitment and onboarding alone. This bar chart breaks down the financial weight of an in-house biller. The median base wage is $46,000. But adding benefits, taxes, software, and training, that fully loaded cost lands between $55,000 and $75,000 a year. That investment often traps practices in a training spiral. You hire a biller, wait months for them to learn your specific payer mix, and right when they become productive, they leave for a better offer. The required knowledge burden is immense. A dedicated biller must constantly master new rules, like the G2211.1 add-on code, to properly capture primary care complexity. They also need to memorize how Medicare, CHIP, and commercial payers each dictate completely different modifier rules for multi-dose vaccines. Despite this required expertise, roughly half of all providers still rely on manual claim reviews and outdated claims technology. Pediatric billing requires deep, specialized knowledge. Expecting a generalist at the front desk to handle it flawlessly between patient calls is a mathematical mismatch. There is an alternative. You can deploy dedicated, credentialed specialists who operate directly inside your existing EMR. Let's look at the implementation roadmap. Step 1 is the kickoff call and mapping phase. We explicitly document your specific payer mix and pediatric rules to eliminate the errors generalist billers typically make. This phase captures the unique details of your operations, mapping out exactly which payers allow same-day preventive and EMM visits, and which require separate coding. Step 2 is the EMR connection. We establish a fully encrypted VPN link in 24 to 48 hours, keeping IT bottlenecks to an absolute minimum. Outsourcing no longer means losing visibility. It means placing top-tier, specialized talent securely inside your own system. Step 3 brings in the talent. Dedicated billing specialists, fully credentialed by AAPC and AHIMA, are trained exclusively on your practice's specific protocols. Step 4 is the go-live pilot. Within 14 days, your dedicated team takes over the daily queue right inside your current platform, whether that is Epic, Athena, eClinicalWorks, or NextGen. This diagram shows the AI-augmented routing layer. Before a claim goes out the door, the system checks it against payer rules, intercepting bottlenecks and flagging errors instantly. Combining human credentialing with continuous AI auditing drops the claim error rate below 1% across the client base. Step 5 eliminates the black box effect entirely. You receive a weekly KPI dashboard giving you real-time visibility into first-pass resolution and your days in accounts receivable. With continuous auditing and weekly reporting, you track down and fix revenue leaks immediately, rather than waiting for an ugly surprise at month-end. This scale compares the final economics. An in-house FTE runs between $1,057 and $1,442 a week. A dedicated credentialed seat through Staffingly is a flat rate of $399. This model provides scalable, reliable coverage, and it is currently securing revenue for over 800 practices nationwide. The implementation starts with a 14-day risk-free pilot. There are no long-term contracts. Everything operates on a transparent month-to-month basis. Getting the billing queue out of the front office completely shifts the dynamic of your practice. Staff can focus entirely on patients without mounting paperwork. Secure your revenue. Start your 30-day free trial and go live in 14 days. Visit staffingly.com/demo or call 800-489-5877.